There are a number of similarities in the two COVID-19 vaccines from Pfizer and also Moderna. Both are mRNA vaccines, which basically means they aren't made from the coronavirus itself, so you cannot catch the virus from the shot. Both will require 2 doses. Both vaccines showed more than 90% efficacy. The Moderna vaccine, of course, 94.5%. And both trials enrolled participants with diverse backgrounds. And finally, both companies are expected to ship out tens of millions of doses by the end of the year, with plans to make upwards of 1 billion doses next year. Now, one significant difference between the two vaccines, and you heard Brian mention this, is the storage requirement. The Moderna vaccine must be kept in a traditional freezer at about 25 degrees Fahrenheit. The Pfizer vaccine must be kept much, much colder at negative 94 degrees Fahrenheit. Here to talk to us about both of these vaccines is Dr. Stephen Thomas, Chief of Infectious Diseases at Upstate Medical University in Syracuse, New York. He is also one of the principal investigators for Pfizer's global phase 3 trial. Doctor, always good to see you. Appreciate your time.
Likewise.
I think, first of all, we know this vaccine, both these vaccines have been fast to development. We also are seeing high efficacy rates. That's all positive news, but I think a lot of people are concerned when you combine those two things about the safety of them going forward. So how do you address that to people who are skeptical and concerned about taking it?
So the first thing I would say is that the speed that they've been able to leverage in terms of developing these vaccines, basically going from identifying a problem to a phase 3 trial result in less than a year, a lot of that is because the risk that has been taken is financial risk. And so it costs, about $1 billion to make a vaccine, and a lot of that relates to the manufacturing process, hundreds of millions of dollars. Well, in the case of Pfizer, they self-finance the risk. In the case of Moderna, it's through Operation Warp Speed, so the U.S. taxpayer. And so they did things in parallel that they would normally do sequentially, and so that saved a lot of time. The second thing I would say is that the regulatory process has been speeding up, and so the FDA, because of the fact we're in a global pandemic, has been in constant contact with these companies, and so when data comes in, they're able to review the data and deliberate and make decisions very quickly. I can tell you from my vantage point and my experience with developing vaccines, I have not seen any safety risks being taken in terms of the level of objective and outside oversight over the trials, or in terms of the process of review from objective and external groups like the FERPAC at the FDA or the FDA itself.
How about durability? I mean, it just hasn't been around long enough. The pandemic hasn't been around long enough. These vaccines, of course. What do you know as far as the hurdles that we still have to overcome to really understand how well they work?
That's a really good question, because only time can tell us about the durability of either the immune response or the durability of protection. That being said, we think about what we expect from our seasonal flu vaccines, and we expect our seasonal flu vaccines to protect us through the flu season, which goes from about September, October to April, May, depending upon where you live. So I do think that the first step is to ensure that these COVID vaccines are definitely safe within the first few months that after they've been administered, and that the efficacy is also going to be acceptable within that first few months period, because we really are at a point now where we have to change the inflection of this curve from where it is now, which is just skyrocketing and exponential growth in many parts of the country, to flatten that out, to start giving a little bit of relief to our healthcare system, and to stop the new cases and the morbidity and mortality associated with that. These trials are going for 2 years, is what most of the trials are slated to go for. So we're going to get that durability information at some point.
Are you concerned, as we just heard the report, about distribution and also the cold storage for the vaccines to make sure that they are as effective as possible?
I am, because you can make a perfect vaccine, but if people don't get the vaccine or take the vaccine, it's not going to do its purpose, right? Vaccines don't save lives, vaccination saves lives. And as was mentioned in the report, some of the cold chain requirements, so the temperature at which the vaccines must be stored and shipped and then stored at the point of administration, are a little bit colder than what we're typically used to. That being said, they have been addressing, all these companies have been addressing that problem, and Operation Warp Speed has been addressing that problem from the beginning. And I will say that early on in development, most vaccines are stored at very cold temperatures, and then the companies do experiments to demonstrate that the vaccine can be stored at warmer temperatures, and the duration with which a vaccine can be stored and used. So I anticipate that the storage temperatures that we're seeing now are probably not going to be the final storage temperatures for these vaccines.
Thank you, Doctor. I have one question from a viewer, and it's COVID related, about the symptoms of COVID. So I want to have you listen to this, and then we'll get your answer on the back end.
I just want to ask those that have symptoms of taste, if they recovered, would they get their taste back?
So she's wondering about people who have lost their sense of taste after having the virus, if they will get that back.
Yes, so people have reported loss of taste and also loss of smell, and depending upon the different reports that you look at, that can be from anywhere from 1 to 2 out of 10 people to anywhere from 3 to 6 out of 10 people who lose either their sense of taste or a sense of smell. It seems to differ also across the planet. It seems that in Asia and Southeast Asia and South Asia, they lose their sense of taste and smell differently and less frequently than we do in the United States, or that's reported in Europe. The good news is the majority of people will get that sense of taste or smell back within a 4 to 6 week period. But there is still a significant number of people, anywhere 10 to 15%, where that loss of taste or smell is going to go on for quite a long time and may in fact not come back. And it's very, very distressing to those people who experience those symptoms.
All right, Doctor, we appreciate your answer to that question, and also about the vaccine, helping us really understand what we have ahead of us. Appreciate your time, Dr. Thomas, as always.
Thank you. Good night.